Assalamu alaikum. The clinical day, starting with this scenario, Mr. Sami, 40 years old, presented with hematuria since 3 days. Please take history and address the concern. Start in seconds after sharing the timer. Please, Dr. Mahmoud, remind me when 2 minutes left.
Sure, Dr. Bassem. You will know the case, Dr. Bassem, before 5 minutes. I know. No need.
Yeah, it's a matter of time management, how to take history and to do examination and to address the concern. It's not to knowing the patient, okay?
Yes.
Okay.
That's for us, not for you, Dr. Bassem.
Okay, good. Good for all of us. Okay, thank you, Dr. Mahmoud. Let's start.
Okay.
Hello, I'm Dr. Mukhtar. The doctor in the clinic today. You must be Mr. Sami.
Yes, doctor.
Okay,
I'm 40.
you are 40 years. Yeah.
Yes, 40 years old.
Okay, we are here to discuss about your health issue. That's okay for you?
Sure, doctor.
Then I will examine you.
Thank you, doctor.
Okay, can you tell me more about your complaint?
Yes, doctor, I have been complaining from my urine get darker than before. I went to my GP and he made to me some tests and told me that might be some blood in my water work. So it is anxious me, doctor.
I'm so sorry to hear about that, Mr. Sami.
Thanks, doctor.
Be sure that we are here to support you and to give you the maximum care. Okay, can you tell me when exactly started?
Yes, doctor, since 3 days.
And is it the first time ever?
Yes, doctor, it's the first time.
Okay, and when it started, you notice sudden, all of a sudden, or gradually?
No, it is gradual, doctor.
Okay, and you notice the blood coming at the beginning, or at the middle, or at the end, or throughout?
No, doctor, no blood. It's darkness only.
Dark only?
Yes,
But
I didn't notice any blood.
No fresh blood, okay.
No, doctor.
And how is the amount? Any change in the amount?
No, doctor, normal amount.
The same amount?
Yes, doctor.
Okay, and frequency, does it change?
No, doctor.
Okay, the water work I mean the darkening, being after a long time or immediately when you
No, doctor, immediately, doctor.
Okay. Any change of your food recently? Did you take different food?
No, doctor, no.
Any medication you received recently?
Recently, no, doctor, no.
Okay, any change before?
Change about what, doctor?
About your diet habit?
No, doctor, no. It is usual diet, yes.
Okay, any trauma to your back or to your private area?
No, doctor, no.
Okay, and do you have any medical condition I should be aware of?
Yes, doctor, I have epilepsy. I treated for epilepsy since I was 10. I take carbimazole.
Okay, any change of the dose recently?
No, doctor, no. It is the same.
Any adding medication?
No, doctor, no.
You are compliant?
Yes, doctor, just a few attacks, but it's okay.
Okay, when was the last attack?
I think, doctor, 6 months.
And after that, it's controlled?
Yes, doctor, it's controlled. I follow up with my nerve doctor. It's good.
Okay. You have any change of your exercise? I mean, you did any exercise in the past 3 days or previous?
No, doctor, no, I don't think so.
Any trauma to your muscle or to your arm?
No, doctor, I don't think so.
Okay. Any recent infection?
No.
In the in the throat, any sore throat or
No, doctor, no.
any infection to your, sorry for this question, in your water work?
Infection like what, doctor? No.
Any infection recently? Okay. Do you feel any difficult to pass through water?
No, doctor, it is normal, but I feel pain in the right flank.
Okay. Apart from this, you have any stone coming or gravels?
No, doctor, I don't think so.
You didn't notice?
No, I didn't notice.
Okay.
No.
Can you tell me more about the pain in your flanks?
Yes, it is just a pain during micturition, doctor.
Okay. And does it go anywhere?
No, just to my right flank.
Okay, and the scale from 0, no pain, and 10 is the maximum. Can you give scale for this
Yeah,
pain?
doctor, I think four or five.
Okay, did you take any painkiller?
Yes, doctor, I take just paracetamol.
Did you take any over-counter medication?
No, doctor, never.
Okay. Back to the history. You have any surgery recently or before?
No, doctor, no.
Any allergy to any medication?
No, doctor, no.
Any antibiotics or antibug you received recently?
No, doctor, no.
Nothing.
Nothing, doctor.
Okay. You feel some burning while being?
No, doctor, no.
No burning.
No burning,
Okay.
doctor.
Okay.
Just the pain on the right flank.
Okay. You feel thirsty
No, doctor.
at all? And no stone.
At
You
all.
told me no stone.
I think no, doctor, no.
Did you so? Okay.
I,
Apart from this, you have any change in the bowel habits?
no, doctor.
Any tummy pain apart from the flank pain?
No, doctor, no.
Nothing.
Nothing, doctor.
You have any headache?
Headache? No, doctor.
Any blurring of vision?
No.
Any pins and needles?
No.
Any weakness?
No, doctor.
Okay. And any difficult swallowing?
No, doctor.
Any intolerance to any weather?
No.
Any short of breath?
No, doctor.
Any chest pain?
No.
Any noisy breathing?
No, doctor, no.
Awareness of your heartbeat?
No, doctor. My heart is good.
Okay. Any joint pain?
Joint pain? No.
Any skin rash?
Yes, doctor. Like in my face.
What happened to your face?
I sent it to group doctor. Yes.
Okay. Any blood coming from any part of your body?
No,
Your
doctor.
mouth?
Never, doctor.
Okay.
The picture in group doctor.
Okay,
Yes.
I can see it.
Mm.
Okay, and let me see. Yes, okay. So no blood coming from any other area from your
No,
body?
doctor. No, doctor. Never.
No coughing up of blood
No.
at all. Okay. Any high body temperature?
No.
Any loss of weight?
No.
Any change of the appetite?
No.
Nothing. Okay.
Nothing.
Yeah. Sorry for this question. You have any partner or casual relationship? Sorry, you have any casual relationships?
No, doctor. Never.
You have partner.
Yes. My
And
wife?
any difficulty in the intimacy?
No, doctor. It's good.
Okay. When the family is the same problem, blood in
Uh,
or dark blood.
yes, doctor. My father died due to my father died since 9 years, I think, but he has also epilepsy.
Okay, I'm so sorry about your loss. My
Thanks,
condolences
doctor.
to you and your family.
Thanks, doctor.
Okay, and what was the diagnosis? Do you have any idea?
No, doctor. He was taking also medication for epilepsy.
Okay. Apart from this, any travel recently?
No, doctor. No.
Okay. And you told me no allergy to any medication.
No, doctor. No.
Okay, this rash in your face, does it appear in the same time
No,
or
doctor.
since long time?
Since I think 9 years.
Okay, and did you seek any medical advice for that?
Yes, doctor. I follow up with my skin doctor. He gave me a lot of treatment, local ointment, but not work good, doctor.
Okay, any blood coming from your nose?
From nose, no, doctor. No.
Okay, and you told me no surgery before.
Yes, doctor. No surgery.
Okay. Did you take any recreational drug? Sorry for this question.
Never, doctor.
Sharing needles,
Never. Never, doctor.
tattooing or
Ne-
piercing,
Never, doctor.
any blood transfusion?
Never, doctor.
Okay. Do you smoke?
Yes, doctor.
How many for how long?
I think 10 cigarette for 20 years.
Okay, and can I advise you regarding smoking because it's harmful for your condition in general and particularly in your disease. So please, you can stop the smoking if you don't, if you are able. If not, we can refer you to smoke cessation clinic.
Okay, doctor. Thank you very much.
Do you drink alcohol?
No, doctor.
Okay. And what's your job?
I'm a teacher.
And how the impact on your job of
No
these
infection.
symptoms?
No infection, doctor. I work good. But
Okay.
just I anxious about this dark urine, this dark
Okay.
water work. Yes.
Okay. May I examine you now?
Sure, doctor.
By examination, any change of the features or only this skin rash in the face, I mean?
You wanted to
Any
yes, doctor.
characteristic features apart from the facial rash?
No, that's just
That's
no,
okay. The
no.
vitals now. I will ask for the vitals.
Vitals pulse regular, normal,
And
70,
how much? 70. Blood
70
pressure,
yes. Blood pressure 140 over 90.
sitting and standing.
No change.
Mr. Sami, anyone told you you are paler than before?
No, doctor. No.
Do you feel dizzy while standing from sitting?
No, doctor. Never.
Okay. Now I will examine the rash in the face.
Okay.
Before the rash, any leukonychia or cholynychia in the finger, in the nail?
No, doctor.
No.
Yes.
Yeah. Any pallor in the palm
In the palm, no, doctor.
and the pulse volume? Okay.
Yes.
No signs of dehydration.
No, doctor.
Okay. Now I will examine the rash in the face. Is it blanchable?
No.
It's
Not
not.
blanchard. Yes.
Oh, and is any oozing around?
No. Not oozing, just it is painful.
Okay. In the mouth, any bleeding or
No,
any
doctor.
sores? Nothing.
No. No, doctor.
Any crust or in the nose or any change in the
No. No,
nose
doctor.
shape?
No, doctor.
Okay. Any pallor and jaundice in the eye?
No. No.
Nothing. Okay.
Nothing.
I will examine the heart now. Quick.
Normal?
Any, yeah, the apex beat in place.
Normal, doctor. Yes.
Normal. Any murmur?
No.
Functional or pathological? Nothing.
No. Nothing, doctor.
Any raised GVP?
GBB, no. Normal.
Okay. The auscultation of the back.
Of the back, yes.
Any,
Yes.
any added
Yeah.
sound? Any crackles or wheezes?
Okay, what do you need? Total passing from the back? Okay, I will send it to the picture with the back.
Okay.
Okay, it is in group. In the chat box. Sorry. I sent.
No problem. I will examine the abdomen.
Okay.
Any
Okay.
organomegaly?
No organomegaly?
No organomegaly. Okay, I will offer examination for the kidneys. Any palatable kidneys?
Yes. It is
Palatable
positive?
kidney.
Yes, doctor.
Both kidneys?
No, one kidney is the right kidney.
Right kidney.
Yes. The picture on group, doctor, best.
Okay. This is scar?
No scar. No. Yeah, that is
It's rash. Okay.
rash.
Okay. Any change in the nail?
And the nail, no. No, doctor, best.
Okay. So you told me history of the family history of cancer or what?
Epilepsy, doctor.
Epilepsy.
Yes, my father died since 9 years, so I will all I remember that he has epilepsy.
Okay. Now I'll examine the legs. Any edema?
No, doctor.
Lymphadenopathy?
2 minutes remaining.
Okay.
Lymphadenopathy, no.
Okay. I will do only pronator drift for the seizure.
Okay.
Pronator drift is positive.
No, doctor. I sorry to pass, but I didn't know pronator drift.
No problem. Okay.
I didn't know.
No problem.
Okay.
So may I know what's your concern?
Yes, doctor. What I have is it a cancer?
I appreciate your concern, Mr. Sami. However, it's seems like not as a cancer. However, we have to admit you and to run some blood tests and scans to be sure is nothing alarming in your symptoms. It might be another condition different than cancer.
Okay. What I have, doctor?
Okay, since you have this rash in your face, along with in the back, some rash in the back, we suspect a condition called tuberous sclerosis. Ho- However, we have to call some doctors, expert doctors, to admit you and to run some blood tests and some scans, and we'll update you about the diagnosis. You have any other concern?
Yes, doctor, it is curable condition?
Curable?
Curable condition, yes.
Uh, this condition, if diagnosed as you suspect, it's controllable one. It's not curable. However, don't worry about this. We will follow up with you. We will give you the maximum support you need, and we will update you about the possible plan. Do you drive, Mr. Sami?
No, doctor, I banned from last. I have it since
Yeah.
6 months, so I not drive now.
Okay, good.
Okay.
This is good also for your safety.
Thank you, doctor.
Any other concern?
Thank you, doctor.
Okay.
Okay. Please give me your differential diagnosis, Dr. Bassem.
Yes, this patient might have tuberous sclerosis as a history of seizure along with nodule or sorry rash in the back, Sjogren patch looks like, and darkening or involvement of the kidney. So on the top of my differential, I put the tuberous sclerosis.
Okay, doctor, what else?
For the hematuria and the rash in the face, it looks like telangiectasia, but again, it's that he doesn't have family history of hereditary hemorrhagic telangiectasia, but it's one of the possible differential.
Okay, doctor, what else?
We can suspect also polycystic kidney disease association with subarachnoid hemorrhage as a family history of seizure and hematuria.
Okay, doctor. What's your investigation? What will you do to this patient?
Yes, we will admit this patient and we will run basic blood tests in the form of CBC looking for anemia and leukocytosis for infection, inflammatory markers for infection to rule out UTI or pyelonephritis in the kidneys.
But you didn't put it in the diagnosis.
Glomerulonephritis? UTI
Yes,
and glomerulonephritis? Yes, but
okay,
it
okay,
might
doctor.
be, yes.
Okay, doctor.
But as a condition, collectively, I put the differential. But yeah, it might be complicated as UTI or pyelonephritis.
Yes, doctor.
But the pain here, again, is pyelonephritis. The patient has low pain or low scale pain. So it might be something really, maybe a stone. Anyway, we will do renal blood test, renal function test and liver function tests. And we can do also ultrasound to confirm if patient might have polycysts or polycystic kidneys or stones or even bladder stone, and to check for prostate as well. However, he's young patient. Apart from this, I could do genetic testing to confirm our diagnosis. CT scan is important if we suspect tuberous sclerosis to look for tuberous in the brain. And yeah, genetic testing is a specific test.
Okay, doctor, but you didn't tell the patient to do genetic testing. Okay, okay. Okay, this patient is tuberous sclerosis. What is the cause of hematuria in this patient?
Yes, as association, tuberous sclerosis patient might have polycystic kidney. And
not association with tuberous. In tuberous, this patient is tuberous sclerosis. What is the cause of hematuria in tuberous sclerosis? Yes, you told me first polycystic kidney, and what else?
yeah, might be stones, occasional renal stones,
Very good.
or glomerulonephritis due to medication.
Okay, doctor. What else?
Leiomyomas in the kidneys, but it's not a cause of hematuria.
Okay.
Infection, occasional infection, pyelonephritis or glomerulonephritis, and renal stone.
Okay, doctor. What is the treatment of this case?
Yes, a multidisciplinary team approach, neurologist and nephrologist, urologist, specialized nurse, along with physiotherapists, social worker. Apart from this, patient education, counseling, and education about the complication and the driving also as safety. Some genetic counseling for him and his family if he's willing for kids or having a kid. Apart from this, the pharmacological therapy, good hydration. In the acute state, also, if patient has pain, we can start him on medication or non-inflammatory, not necessarily anti-inflammatory, according to the nature of the pain and according to diagnosis. If need antibiotics, we have to do also urine analysis for that, looking for cast or red white blood cells, and that's it. So antibiotics if he has glomerulitis.
Okay, doctor, and the skin doctor also for angiofibroma.
Yeah.
Okay, thanks, Dr. Basim. Thanks, very good.
Okay, thank you, Dr. Mahmoud.
I know you will know the
How,
question.
no, I didn't know. Why telangiectasia with tuberous sclerosis?
No telangiectasia, Dr. Basim.
What is this in the face? You mean?
No, this face is angiofibroma. It is the rash of tuberous sclerosis.
Show me. This is angio.
Yes, this is
Oh,
angiofibroma.
okay, yeah. I thought at the beginning it's HHT. That's why I was wondering. Okay, but
Yes.
Sjagren nodule is characteristic. Yes, you're right.
Yes, Chagrin, but this fibroma, I'll take this from.
Yes. Yeah, now I realize because I was in hurry to look for the
Yes, Dr.
from the
Basim.
first look you can
Telangiectasia, yes.
yeah say
بس
this is
ما شاء
telangiectasia.
الله، بس بدي أعلق شغلة كتير حلوة عملتها دكتور باسم. حتى أنا ترى للأمانة اقتنعت إنه HHT، بس وقت سألت سؤال كتير حلو is it plungible؟ قال لك لا.
Yes.
رجعت فتحت الصورة مرة ثانية وقلت أكيد في شيء، بعدين انتبهت إنها أدينوما. فسؤالك يعني أنا برأيي لما بيكون الإنسان بيتدرب كتير من الشغلات الحلوة اللي بيكتسبها، إنه حتى لو ظن غلط بيكون عنده القدرة إنه يأكد هل هذا الظن غلط ولا صح. والله
Exactly.
مجرد إنك سألت بلانشبل وجاوبك قال لك لا، قلت لا في شيء غلط، رجعت وفتحت الصورة لقيت أنجيو فايبروما. فعرفت إنه نحن ماشيين غلط، لأن حتى أنا أول ما اطلعت على الأنف لفت نظري واحدة حمراء، عن جد شكلت ال HHT.
You're right.
يعني
Yeah.
تراي إنك تسأل هالأسئلة الحلوة هي. كان سؤالك بمحله وقت سألت على بلانشبل ولا لا.
Thank you, Dr. Hind. But again, it's a confusing picture. Yes,
لا
from the
هي
first
it's
look.
confusing I agree، لأنه بيلفت
Yeah.
النظر الليجن اللي بالأنف الصراحة.
Yes, exactly. Yes. And also going with the hematuria, you can suspect it with
عليك
hematuria.
لا كل شيء ماشي ترى، بس لما قال لك it's not blanchable فعلا it's like eye opening. go back and check again بهالمعنى يعني.
Yes.
بس أنا عندي سؤال، ليه الهيماتوريا painful؟
Pain, yes, due to pain in the right flank, due to maybe cyst or angiomyolipoma, or also maybe individual diagnosis.
تمام، انت قصدك معناتها بدها تكون cyst rupture او cyst torsion.
Yes.
لانه
But
عادة
structure.
امل ال AML لحالها ما بتعمل painful hematuria. يعني
Yes.
it bleeds painlessly. فلكن اذا صار فيها pain وانت عم بتفكر بموضوع complicated cyst I agree. معناتها بده يكون rupture torsion
cyst or renal cell carcinoma.
infection on top of a cyst ولا something. وحتى هدول البيشنت عندهم ستون. فإذا أنت كنت عم تفكر فيها بهالطريقة yes it makes sense إنه complicated cyst ما هي cyst عادية.
Yes, doctor, this case usually come in Pakistan. Every night in Pakistan there is tuberous sclerosis.
and it is painful يعني. تمام.
Yes, and the rash in the face is painful. The angiofibroma is painful because it is subcutaneous.
أنت قصدك painful كمان؟ أنا لا قصدي painful على أنت
Yes,
عطيته
painful.
كمان painful angiofibroma.
angiofibroma yes في السكن
صح
في
والله
الفيس
تذكرت قلت
in
له
the
وقت
face.
سألك is it itchy وقلت له it's painful. أوكي شكرا كثير على الكيس.
Yeah, for the pain in the renal area, or flank pain. I mean, the cyst will be painful only if scale will be
Rupture.
higher. Yes, rupture,
Mhm.
and it will be very severe pain, very
Yes.
painful. It might be more than 8 in the scale, I mean. But you give me mild scale. That's why also it was confusing. Okay, so your comment, Dr. Mahmoud, Dr. Hind, give us a precious comment. Thank you, Dr. Hind.
I can't comment. I can't comment for you, Dr. Bassem.
No, what I missed
It's never.
and the differential.
Yes. Yeah.
No, but you asked me for the differential, and I give you. You were
Yes,
hesitant about it. So what the problem of the differential?
Yes, doctor. The differential will be also renal cell carcinoma and UTI. It is most important. The patient 45 and UTI, and you tell the examiner that we have to do blood test and urine culture for UTI. You didn't tell in the diagnosis.
Yes, you're
okay.
right.
Okay, Dr. Bassem, first you tell about you have trauma. It is good. In the examination, you didn't listen to renal puree. There is no renal puree, but you should put your stethoscope. Yes. And the second pain perform. Yes, if you suspect it is tuberous sclerosis, you should tell me what's your performance in your life. Like the patient will be have some mental retarded.
Of course, but he's a teacher. Yeah.
Yes, it is a teacher.
Okay. What else? Yes.
Okay.
But you're right.
And,
yes.
Yes. You should also the patient genetic test. You should bring your sons to have to be screened because they might have this disease. Screening test to the patient. You didn't tell the patient genetic test.
Okay.
Okay, and you examined the skin very well. Treatment investigation very well. You examined the rash in the face. Everything good, Dr. Bass, mashallah.
The nail. Why not nail change?
No need to change. Why no? It is not matter.
دكتور باسم مو ضروري يكونوا كل الفيتشرز
Yes.
صح في بيري انجول
Okay.
في بيري انجول
Yeah.
فايبروما عادة
Yes.
وبعدين لازم تسأل مو بس عن النيلز تبع الهاند يعني لو قال لك
التوز.
ما
Yes.
في فهو معه حق لازم تسأل عن النيلز تبع الفيت كمان
التوز.
احيانا
Yes.
بتكون موجودة بالفيت ما بتكون بالهاند واحيانا ما بتكون موجودة نهائي شاجرن والانجيو فايبروما انف بالفيس وكمان
Yes.
اعتقد سؤال الهيرنج بالهيماتوريا كمان is very important يعني بالعادة يعني أي كيس هيماتوريا لازم نتذكر الريسنت انفكشن ما شاء الله أنت تذكرتها ومو بس recent infection sore throat أو upper respiratory حتى skin infection لأنه السكين infection بالستريب ممكن يخلي لك فعينك من الووند skin infection sore throat upper respiratory كله بيمشي تمام recent febrile illness أو recent increased temperature due to any illness والهيرنج والRCC painful بدنا يعني بس ننتبه لما بنيجي بنقول painful و painless في عنا painful و painless هيماتوريا وعنا هيماتوريا with abdominal pain كمان هي يطلق عليها painful هيماتوريا فالRCC هي بتعمل مو painful هيماتوريا بتعمل هيماتوريا plus abdominal pain تمام فإذا أنا ما عندي abdominal pain أو حتى loin pain is acceptable لأنه هون positive it's good differential بس ننتبه على الفرق بيناتهم إنه الهيماتوريا painful و painless is the pain during micturition ولا you mean الأبدومين أو اللوين pain حتى تحط differential يعني تكون ضاغطة على ما يكون في مثلا هو ما عنده abdominal pain أو ما عنده painful هيماتوريا يعني البلود باليورين is painless فبس نتأكد من هالشغلة لأنه بتساعد بالديفرنشيال وانت لما عرفت على الراش تبع الباك شو كان سؤالك؟ سألته راش anywhere else صح؟
No, doctor. Yes, Dr. Bassem. You should ask when you see the rash on the face if you have any rash.
Any rash elsewhere. كنت مسكت فورا التلانجكتيزيا لأنه التلانجكتيزيا بيكون في راش تلانجكتيزيا راش بالهاند باللبس مثلا أو كان حيورجيك أوتوماتيك الباك والأبدومن تمام فلازم أول ما تشوف أنت الراش بالفيس تسأل أني راش elsewhere التروما قال لك عليها فكنت كاتبت لأنه ما أعتقد إنك سألت على التروما
No, Dr. Bassem told the trauma. Yes, told me.
سألت على الفيفر والويت تشينجز وهالأشياء صح؟
Yes.
طيب سؤال tuberous sclerosis هل يعتبر كانسر أو لا يعتبر كانسر؟
Not cancer.
It's
It's
not
non-tumor.
cancer.
Yes, not tumor. Not tumor. Yeah, it is benign.
benign نحن
benign
بالعادة
tumor.
شو
unless
عليك
RCC.
نور benign tumors تمام. فيعني يفضل إنه أتقلك do I have cancer or not لازم
Yes,
نقول له you have the harmless form of cancer what we call benign growth in multiple organs تمام. It's usually familial run in families and we call it tuberous sclerosis لأنه أعتقد tuberous sclerosis هو نوع من أنواع abnormal growth لكن benign تمام. ف it's not cancer يعني it's not cancer يعني لا benign ولا malignant تمام. فيفضل إنه تقول له it's a harmless form okay in which there is multiple growth in multiple organs لأنه ما في تفسير لها تاني غير إنها abnormal growth يعني تمام. وabnormal growth إذا كان benign أو malignant يطلق عليه كانسر أو بالأحرى الشخص العامي بيفهموا إنه هو كانسر هذا قصدي تمام.
Yes.
أعتقد لا والله ما في شيء تاني يعني أنا هدول كتبتهم بس وأنت عم تحكي لكن بقية الأشياء you covered it وعملت system review حلو بس يعني بس شغلة الهيرينج يلي
Mhm.
ممكن بالعادة نتحاسب عليها بالهيماتوريا وغير هيك الله يعطيك العافية. وممكن كمان ينسأل على الفوميتينج على النوزيا تمام لأنه دائما أحيانا بيجيبوا هيماتوريا ورينال إيشوز
Yeah,
بيحبوا انه تو
انكفالوباثي.
اكسكلود ايوه عليها
Uremic
معروفه
encephalopathy.
كدني انجري يوريميك لانه هي
Mhm.
تعتبر رينال سيمتوم
But it
فالرينال
will be
سيمتوم نحن
yes, go ahead because I ask for the amount. It will be less amount as well. I mean,
مو كل الاكيوت
initial.
كدني انجري بيجوا
Yes, you're
باوليجوريا
right.
في اكيوت
He might be
كدني
also in
انجري
the
بوليجوريا.
polyuric. Yes, exactly. Yes.
فانت لما بيجي رينال سيمتومز بالعاده نحن ما بنقول اليوريميك سيمتوم بالعاده بنعمل سيستميك ريفيو لكن لما
Mhm.
بتكون رينال كيس فنضيف على السيستم ريفيو تبعنا مو بس اليورين واللوين
Mhm.
بين لازم نسال على البافنس around the
Toughness.
eye
Yes.
نسال على اليوريميك
Tremors.
symptoms
Yeah.
asterixis
Yes.
vomiting nausea itchiness يعني بيعتبروه related system فبيدققوا عليه أكتر. فأعتقد يمكن بس هي الأشياء اللي ممكن نضيفها وإلا ما شاء الله عليك يا دكتور باسم.
العافية يا دكتورة. Thank you so much. Really appreciated your comment. Okay. Thank you. Also, we learn from the missing point from Dr. Hind and Dr. Mahmoud as well. Any other comment, please feel free to comment on me.
My case, Dr. Basim.
Yes, we will start now. Yes, I will read the comment. Your case first, then I will read the comments, okay? You have Mr. Where is the comment? Where is my case? I wrote it earlier. Why it's not coming?
I think not right, Dr. Basim.
Sorry, I wrote it before your case, but I think it was lost. Alhamdulillah, still in the paste.
Yes.
I pasted. Still memorized. Okay. Mr. John Smith, 60 years, diabetic hypertensive dyslipidemic, referred to you from the GP, complaint of difficulty swallowing. Sit with the son, Mr. Donald, address his concern. Yes, I agree. Dr. Ahmed wrote very important information. Carbamazepine in tuberous sclerosis is contraindicated. Okay, so it's not recommended to start patient on carbamazepine. I mean, tuberous sclerosis. It's a trigger for a seizure. This patient will be on sirolimus, some medication for tuberous sclerosis. But as anti-epileptic, carbamazepine, one of the contraindicated medication. It should be avoided. Dr. Rabia, you are here? Yes, CNS examination agree for. That's why I did only pronator drift, but it was very late because I was going with HHT. But when I see the back rash, I realize renal bruit. What signify? Please explain. Renal bruit if the patient having renal artery stenosis, but it's not the case. Renal artery stenosis association with neurofibromatosis. It's not in this patient. But anyway, just act like you are examining the kidneys. If you have time, of course. Some other manifestation you have to examine, like the skin lesion. Angiomas, yes. Adenoma, sebaceous, yes. Hematuria, renal angiolipoma, cyst, polycystic kidney disease, renal cell cancer. Yeah, I missed the cancer. It's one of the important association. It might happen, and also it might cause hematuria, renal cell cancer.
And also, Dr. Basim, it might happen in tuberous sclerosis.
Yes, I said it's association. Yes,
Yes, doctor.
association. Yeah, and it's a cause of hematuria.
Yes.
The cause of his parent death might be angiolipoma or angiomyolipomas or something, seizure. I'm not sure, but what the cause of death, Dr. Mahmoud? His father death?
Cause
It's not
this
vascular
no.
element. Yeah.
Yes. Patient was 40 years old.
التيوبر سكليروسيس بيعمل ليجنز بالبرين سبيس اوكيباينج ليجنز
Yes.
بيعمل مشاكل كتير يعني كنيورو
كستروك you mean.
والسيفير فورم منه بيجوا كمان mentally retarded مثل ما انتم
Yes.
كاتبين فاحيانا البيشنت he don't live long
Yes.
تمام وبيجي معه cardiovascular complication كمان
Yes.
فيعني there are many causes of death could be due to
Angiomyolipoma.
cardiac, neuro, could be natural history تبع الديزيز not
Yes.
managed properly فيعني مجرد انه قال لك الدث you have to inquire if the patient know it will be good and well بس if the patient don't know على الأقل بيعطيك فكرة انه في familial elements لانه هن ماتوا قبل عمر 50 أو 60 يعني early death فأكيد في familial issue تمام لو ما عطاك مثلا هارت اتاك بعمر 70 ما عطاك ستروك بعمر 70 anything younger أو even if the cause is not known بس younger معناتها familial issue بغض النظر
Yes.
شو السبب ف it will support إنه
The
diagnosis genetic
diagnosis.
ولا familial
Yeah. Yeah. Thank you for the comment, Dr. Hind. If no vision about von Hippel-Lindau disease, you wrote, if no vision or no cerebellar symptoms, it will be less likely to have von Hippel-Lindau, but it will be good to exclude. Yes, you're right.
Pheochromocytoma, yes, no pheochromocytoma.
Yeah, so you'll have other association of von Hippel-Lindau. Also, kidney will be associated or diseased. As hamartomas, right? It will be hamartomas in the
لا
brain and
بتكون
cerebellum.
هيمانجيوبلاستومز
Yeah,
انت عندك
hemangioblastomas.
الفون
And
هيبلاندو
the
هيمانجيوبلاستوما مثل type of cancer بالبلود vessels
yes,
فما بيكون benign بالعكس بيكون malignant و easy bled والفون هيبلاندو كمان في إلى association مع البوليسيستيك كيدني إلى association مع الار سي سي إلها
yes,
association مع السيمبل سيست بالبدايات فإتس a good differential كهيماتوريا بس بدك تسأل كم سؤال عليها فيجن انتاكت سيربيلر
balance.
انتاكت لأنه
Yes,
عادة في ستوما كمان بالبرين وبالريتنا فإذا لقيته نورمال فإتس less likely يعني
yes,
at least it can be a differential for cystic renal lesion بس less likely in a patient with normal vision و no cerebellar manifestation.
yes, right. Okay, tuberous sclerosis, HHT. Yes, hematuria, sorry, scenario. Okay, we can go ahead now. You're
Yes,
ready,
Dr. Basim.
Okay,
Sure,
we'll
Dr.
reset the timer. Yes, here you go.
Okay, good morning. I'm Dr. Musa, doctor in the clinic today. Let me confirm you are. Can I confirm your name, please? And
I am
age?
Donald. Donald, doctor.
Donald. Okay, Mr. Donald, you are 60 years old. Yes.
No, I am. My father, he's the one 60 years. He's John Smith, my father, and I came with him, doctor.
Okay. Okay. Nice to meet you, Mr. Donald. We are here to discuss about your father's condition. Is it okay with you?
Yeah, doctor, sure. I came for that.
Okay. Brought to my knowledge that he has difficulty of swallowing. Could you tell me more about his condition, please?
Yeah, doctor. Actually, it started as slow duration and I mean long duration and slow. It was gradually. Now he's unable to eat anything. It started
Okay.
6 months back.
Okay, I'm very sorry to hear about that, Mr. Donald. But can I know if this difficulty of swallowing, what do you mean? It is difficulty for fluid or food?
Actually, doctor, it was started with the solid first, and now for everything, even the liquid, even the water, he cannot take it. Always he cough after that.
Again, I'm sorry to hear about that, Mr. Donald. But can I know, is the food stuck in his, how is the food stuck exactly?
In the middle of his chest, doctor, or at the beginning and the middle, yes.
Okay. Is it painful or no
I
pain?
think, doctor, because he always cough after that.
Yes, no, there is pain during
No, he
swallowing.
didn't say it's painful.
Okay, okay. Can I know, there is any fever,
No,
case body temperature,
no.
any weight change, loss of weight?
Of course, doctor, he lost weight because he's not eating well. Last 3 months, almost he's not eating.
Okay, I'm very sorry to hear about that, Mr. Donald. But any lumps or bumps in his body?
No.
Okay, good. Did you feel that there is any dryness in his mouth?
Yes, doctor, I noticed because always he's afraid to swallow or to drink or to eat.
Okay. Okay, is there any weakness in his body?
Yes, doctor, he has weakness recently for the last 1 year, and I guess it's also worsening day after day.
Okay, can I know it is like fatigue or weakness in his body?
No, weakness, not fatigue, doctor. He's not able to carry or to hold. I
Okay.
notice also his hand being very weak.
Okay, can I know this weakness change your any diurnal variation, like more in the morning or at the night?
No, it's always a doctor at the day, all the day.
I'm very sorry for that. Any weather performance, Mr. Donald, to your father?
No, no,
Unusual cold tolerance.
no,
Okay, any skin tightness?
no,
Okay, very good. Any joint pain?
no, doctor.
Any eye problem? Any visual problem?
No,
Okay. Any hearing problem or test?
no,
Okay, very good. Okay. Um, can I know if he has any disease spells or falls?
no,
Any unsteadiness or shaking of the hand?
no.
Okay. Any cough? You have?
Yeah,
Do
he
you,
always cough after the food when he ever eating or drinking. He has choking, then he has cough.
okay. Sorry for that, Mr. John. Is your father? Do your father have any racing heart?
No,
Okay. Any night sweat?
no,
Okay. Um, any skin change?
no,
Okay. Just to confirm, Mr. Donald, please, he has any joint pain? No joint pain, yes?
no,
Okay. Okay. Any hand pain?
no,
Any change in any discoloration or of his hand after after cold,
no,
with after exposure to cold?
no,
Okay.
no.
Okay. Um, sorry, Mr. Donald, your father has diabetes and many. Okay, can I know what's his medication?
He's taking two medication, doctor. It's a tablet, metformin and glyclazide.
Okay, any recent change?
No, doctor, he is well controlled.
Okay. Can I know, do you know what's last hemoglobin A1C?
7.5, doctor.
Okay, very good. Okay, and for hypertension?
He's
Increase the
taking
blood.
amlodipine and thiazide.
Okay. Any recent change of his
No,
blood pressure medication? Okay, and
no.
for fats and cholesterol. He's taking any medication?
Yes, he's taking
Okay.
atorvastatin 20.
Okay. For how long?
He has diabetes for more than 10 years, hypertension for the last 5 years, the same also duration for lipid. problem or fat problem.
Okay, Mr. John. Mr. John, can I ask, is your father smoke?
He was doctor, but now even he's unable to hold the cigarettes.
Okay, sorry for that again, Mr. John. Do your father drink alcohol?
Again, doctor, he was, but now also he's
But
unable.
also unable. Okay. Sorry for that, Mr. John. Can I know what's his job?
He's retired, doctor.
He retired. Okay. What was his job?
He was bus driver.
Master. Okay, very good. Okay. Do your father have any tummy pain?
No,
Okay. Any burning urine or fluid urine?
no.
Okay. Did your father follow up with eye doctor? His eye doctor?
Eye doctor, yes, but for the last 6 months, I guess he's not able to move from the bed.
Oh, okay. Did he have any vision, blurring vision?
No,
Or
doctor, his vision is fine.
it's fine. Okay. Can I know any previous history, like any history of stroke or heart attack?
He had history of what's called mini stroke.
Okay.
It was 1 year back, and they told us about the importance of this medication and control of his blood sugar, blood hypertension. But after that, he's fine.
Okay. Can I ask if there is any family history of stroke or any blood
Yeah,
disease?
my grandfather was having a stroke, big stroke,
Okay.
and he died after he had the stroke.
Okay. Um, okay. Any change of his bowel habit?
No,
Okay. Do you notice that any discoloration of yellow discoloration of his eyeball
no,
or skin? Okay.
no,
Any history of itching or bad mouth smell?
no.
Okay. Okay. Did you notice that your father has the shaking of the hand?
Yeah, doctor, I noticed some like waves in his hand. I don't know what is it. Like tremors, doctor. Yes. Sorry,
No,
like shakings. Yes.
like shaking. Okay. Good. Okay. Any heartburn or acid brush?
No.
Okay. Can I examine your father, please?
Sure, doctor. You can go to him.
Okay. First, I will examine the hand for any leukemia or
No.
pulmonary erythema.
No.
Okay, then I will check tremors and flapping tremors.
It's not tremors. Not fine. Not flapping. It's fasciculation.
Okay.
And there
Okay.
is wasting in the hand muscle.
Okay. Okay. And then I will examine the pulse and the blood pressure.
Normal pulse is 75. Blood pressure 145 over 95.
Okay. Then I will examine for proximal myopathy.
He has weakness, diffuse weakness.
Diffuse weakness.
Yeah.
Okay.
Proximal and distal.
Proximal and distal. Okay. Okay. Then I will examine the eye for any ptosis.
No ptosis.
No ptosis. Okay. Pallor.
No pallor.
Okay. Mouse for central cyanosis.
No cyanosis.
Okay. GVB. And I will examine then the chest. Sorry, the thyroid for any thyroid enlargement.
No thyroid swelling. But when you examine his mouth, you notice also some fasciculation
Circulation.
in the tongue.
Okay. Sorry, Dr. Bassem, I want to examine the arm. It is floppy or stiffness?
Floppy.
It's floppy. Okay. And the reflexes?
And normal reflexes.
Normal reflex. Okay. Sensation?
Sorry, it's mute reflex. Mute.
Mute areflexia?
Areflexia, yes. Areflexia.
Areflexia. Okay. Sensation?
All modality of sensation intact.
Okay, and there is fasciculation. Okay, then I examine the lower limb also. There is weakness in the lower limb.
There is weakness.
Weakness proximal or distal?
Both.
Both. Reflex.
Diffuse.
Okay, reflex also.
The reflex is a little bit exaggerated in both legs.
Okay.
You can say it's exaggerated. Yeah.
Okay, and the plantar reflex? Upward or
Upgoing, yes.
upgoing? Upgoing. Okay. And can I ask Mr. Donald, please, does your father... okay, I want to examine the gait.
He's almost bedbound and he's unable to stand. So it's difficult. The examiner told you no need or skip this examination.
Okay.
What else you want to examine?
Okay, I want to examine the coordination
Difficult to do because of the
of the weakness. Okay. Okay, I will examine the back for any operation.
Nothing, no back scars.
No back scars. Okay.
What else?
Okay.
Don't forget the complaint.
Yes, yes. Okay, the complaint I will see the most there is fasciculation.
So yeah, fasciculation in the tongue. You want to do other examination?
Swallowing. I want to swallow, Dr. Bas? Or
Yeah,
sensation.
so you at least see the oropharynx and offer swallowing. It's
Okay.
the examiner, of course, will tell you no because the patient will shock or will. Okay.
Yes.
But yeah, you have to offer for even for the back of the tongue for candidiasis. Okay.
Yes, yes. Dr.
Okay,
Bas.
2 minutes left.
So
2 minutes.
so there is the candidiasis.
No candidiasis. I mean,
No
to
candidiasis.
offer it might be a cause of difficult swallowing.
Yes. Okay, Mr. Donald, can I know what's your concern about your father?
Does my father have stroke like my grandfather?
I really appreciate your concern. It is one of the possibility. It is one of the possibility, so we have to exclude it. So what we are going to do, we will admit him. I will do some scans on his brain and also the main column, and we will have another meeting to discuss the result. But according to examination, I think your father has a disease of defense system, which is supposed to attack the bugs. In your father's condition, he attack the nerve cable and the muscle. So we will admit him and do some investigation, and we will have another meeting to discuss the case.
What do you think, doctor? What's the name of the disease?
I think Guillain-Barré.
Okay, doctor. So you will admit my father?
Yes.
Okay, time is up. Let's go to the examiner questions.
Okay, wait, Dr. Basim. 1 minute to think.
I will give you 10 seconds.
Yes, I will say it.
Yeah, collect your thoughts.
Our motor neuron.
Gathering all these symptoms, finding, then we'll go ahead for the examiner question. When you're ready, let me know.
Okay, Dr. Basim.
Yes, let's go. Present your case and give me 3 differential.
Okay, Mr. John present to me with difficulty of swallowing, which is not painful. During examination, there is weakness all over the body, I think. There is feature of lower motor neuron lesion with intact sensation. in the upper limb, and in the lower limb there is feature of the upper motor neuron lesion.
Okay.
So my first diagnosis will be motor neuron disease, but against that the age of the patient is 60 years old. My second diagnosis will be Guillain-Barré syndrome.
Okay.
And
Third, give me one more differential.
okay, proximal myopathy.
Okay, you mean mixed connective tissue disease or dermatomyositis?
Okay, بس against that no rash.
Okay.
Yes,
so
myositis, dermatomyositis. Yes, doctor.
dermatomyositis. Okay. You said against motor neuron the age. What do you think about the age? Why against?
Yes, but because motor neuron disease come in middle age from
No, it's
25.
not necessary. More, no. It's more than 50. The common age. Okay. Let's go to the investigation. How you investigate this patient?
Yes, I will admit the patient. I will do CT to exclude any hemorrhage, and also I will do MRI to exclude other causes of lower motor neuron lesion and upper motor neuron lesion. And after exclusion of all causes, my diagnosis will be motor neuron disease because it is disease of exclusion.
Perfect. Will you do LP?
Yes, I will do LDP.
Excellent. Okay. How to manage this patient?
Okay, multidisciplinary motor neuron disease is treated by multidisciplinary team, by patient education and patient counseling, and also physiotherapy. And I will and also SALT team, and yes, and the care of his swallowing. I will involve the dietitian and also the surgery for any like any stent or tracheostomy or nasogastric tube or big tube like
Perfect. Yes. Okay. Do you know or do you have any idea about the types of motor neuron disease?
Yes, it is the 3 types. I think
They are 4, so don't mention number. Just give me the common.
Amyotrophic lateral sclerosis.
Excellent.
And also I don't remember the top best.
Yeah. Remember 2 lateral and 2
ALS.
progressive. Amyotrophic lateral sclerosis and
I don't remember.
okay, 2 lateral.
Yes.
And 2 progressive. Just to memorize it and to make it. Okay, 2 lateral
Yes.
and 2 progressive. The lateral is primary and lateral. Okay.
Yes.
Sorry, primary and
Amyotrophic.
amyotrophic. And the progressive bulbar and spinal.
Yes.
Again, 2 lateral, the amyotrophic and the primary, and 2 bulbar, the progressive and the muscular. Progressive bulbar palsy and progressive muscular atrophy. And the 5th is called spinal muscular atrophy. I know it's difficult to remember, but at least remember the most common, which is
Amyotrophic lateral sclerosis.
And the most dangerous?
Progressive spinal bulbar.
No,
Yes,
bulbar.
yes, bulbar.
Yes.
Yes.
Okay. The last question. Do you have any idea about any pharmacological medication therapy for this patient?
Yes, motor neuron disease have a medication called riluzole. It can't treatment of motor neuron disease, but can increase the life expectancy of the patient.
Okay, and what other mood can give you expected or increase the life expectancy?
No drug.
No, not drug, yes. The other option can extend his life expectancy more than the riluzole.
I don't know. Amitriptyline.
Not drug. Is a
No drug.
yeah method or technique. BiPAP or non-invasive ventilation.
Yes, BiPAP. Yes.
Okay, so the riluzole as a medication extend 3 months, and for the BiPAP for 6 months. The life expectancy. Okay, well done, Dr. Mahmoud.
Thank you, Dr. Bass.
Yeah, you reached diagnosis finally. It's difficult case, and whenever you feel a lot of neurological manifestation, you have to think about complicated disease. And motor neuron, one of the mix or cocktail, upper motor, lower motor, bulbar symptoms. But for the analysis, you did well for the dysphagia itself. It started by what type, either food or fluid, and the duration, the progression, the timing. Very important to rule out myasthenia gravis in patients. It's very common topic. Stroke also here is very likely, and you have to put it in the differential. Patient has already TIA. He might have also stroke with bulbar affection, right?
Yes, doctor.
You have to put it in the differential. He has all the risk factor for stroke, and he had previous TIA. Stroke as bulbar on it's enough to diagnose stroke. That's why you have to do OCT and MRI. However, the patient is having another neurological manifestation, which is weakness. You ask about the weakness, but you didn't ask about the sides of the weakness. Is it both side or both arms, both legs? And when you do examination, also do it. A pronator drift, you have to offer it. Hoffman, also in the hand, just to roll out stroke. This is regarding the dysphagia. You ask good question. Is there any pain with swallowing? What do you think the cause of painful swallowing?
Yes,
Difficulty.
fungal or ulcer.
But
Fungal infection.
excellent, yeah. Fungal or soreness or candidiasis also. Okay.
Yes, doctor.
Cancer, one of the differentials, so you have to ask about the constitutional symptoms, and you asked already. Loss of weight, night sweat, body temperature. And in the history also, the weakness, the fasciculation, the numbness, the sensation, you have to do, and analysis of the blood pressure or the comorbidity, you did it, which is perfect. The local cause, you said it, and you suspect rheumatoid with association. You
Yes,
yeah, you
grapes.
ask, yeah, you ask many times for it, but once I deny, don't insist. There is something else. It's then okay. You ask for the joint pain, I told you no. Then you ask about the skin, Raynaud. Anyway, good to ask and
Yes.
good to show the examiner that you are screening for dermatomyositis. And by the way, you can ask also for the muscle pain. Does your father have any muscle pain
Yes.
or skin rash or dermatomyositis? It's good differential. Systemic sclerosis also one, but one of the differential, but it will be in younger age, and the female more common in female than male. Okay, motor neuron disease, by the way, the most common age more than 50, not in the young age. Even in the real life, I see a lot of patients in ICU due to motor neuron disease involvement, all of them above 50. I didn't see less than 50. Okay, maybe it's in another variation, but it's here it's not common to be less, but in general it's more than 50 as common. Back to the symptoms, other symptoms will be, I think, clear. The bowel habit also, it will be not there. I mean, nothing will be changed unless he has some complication due to long-standing disease, which is diabetes. And the control of the bowel habit is very important to ask, as involvement either stroke or even for the motor neuron disease, but it's almost intact in the motor neuron disease. It's not common to be impaired, but you can ask about his control of the water work and control of the bowel or back passage. Okay. Apart from this, the examination, you examine well, but always offer the back of the tongue and the mouth itself as a complaint examination. dysphagia is the complaint. So you have to examine the mouth well.
Yes, and also
Apart-
investigation, Dr. Basim. Yes, I should do مثلا upper GI or social manometry.
No, it's not. If no indication, no need. Here, the diagnosis is very clear, right? You said motor neuron, and you said good word. It's a diagnosis of exclusion. You will do a lot of things in this condition. You will do MRI, you will do nerve conduction, you will do LP, you will suspect myasthenia, you will do antibodies, you will do a lot of things. And also, you said good approach. You involve the SOL team, which also this is their job to diagnose if he has any problems in swallowing. But it's not achalasia. Achalasia will be different condition, if you want to say, right? You are suspecting achalasia or systemic sclerosis. I mean, for the esophageal sphincter pressure, it's not esophageal sphincter pressure issue. And also, you have to ask about it is difficult to start or to initiate the swallowing or at the medial. But you ask where exactly the pain or where exactly the difficulty. And I told you it's in the middle or in the starting swallowing. But again, it's important to rule out myasthenia gravis as timing. At the evening, it will be more progressive, and to swallow or the food particle will come from the nose. This questions for myasthenia gravis. However, this is not the case, but you have to ask this question, okay? Apart from this, in the examination, you have to examine, as you did, motor neuron disease as tone, power, reflex. Always start like this. If you start different way, you will lose your approach. You lost it, but again, you did it back after you remember the tone and the power of the reflex. This condition will be upper and lower in the upper. Okay, as you did. The sensation modalities, again, it will be intact. This is motor neuron disease, anterior horn cell fiction. So the sensation will be intact all over. Coordination, if he can do, but it's not because of the weakness. The gait as well, he will be. And you miss also one important association to the motor neuron disease, the mentation. Why you ask the son about the father condition? And I told you he's bed bound. You can ask about, or you have to ask about his cognitive function. It might be associated with frontotemporal dementia, right?
Yes.
So you have to ask about how is his awareness? Is he okay? And after all this suffer, you have to ask who's taking care of him and who's he's if he is able to do his daily activity or need some help. It's very important here to offer occupational therapist to support him and to help him. Okay. And when you ask about smoking, I told you he's having difficulty hold the cigarette. You said it's very good. Yeah, it's very good to. Sorry, you said I'm so sorry about that. Yeah, you are sorry about the weakness, but the good thing also he's
Yes.
not smoking. So don't be sorry for stopping smoking. But for the weakness, you said it in the history. No need to mention it. Okay.
Yes, Dr.
Anyway, yeah. Okay. Just for yeah, for fun. This comment. Okay.
Mm.
Yeah, apart from this, you did great, Dr. Mahmoud. I think you cover a lot of things. The differential again, let's say in order, motor neuron disease because
Stroke.
of the fasciculation and motor neuron characters. All of them are there. Stroke, yes, one of the differential. And
Yeah.
the third,
Malignancy.
no, as long as no loss of weight, you can rule out malignancy. But there is loss of weight. Obviously, patient is losing weight due to less oral intake, right? So let's say motor neuron disease and stroke, and maybe something local in the mouth or local cause. What you said in the other differential, you can say
I
also
said Grand-Paris, but Grand-Paris lower.
Guillain-Barré. Yeah,
Lower
good,
only.
good to raise this issue. Whenever you mention Guillain-Barré, you have to ask about the history of infection.
Mm.
If you suspect it, you have to ask, and it will be for acute onset. This patient is having this complaint since 6 months. So Guillain-Barré will be more progressive and more acute in onset. Okay, you can say myasthenia or dermatomyositis, but again, it's that and this, no weakness and no muscle pain, no rash. For the myasthenia, no eye affection or no vision affection. Okay.
Okay, doctor.
Yeah, I'm done with my comments. If anyone want to comment, he's okay, or he's more than welcome to comment. I think Dr. Hind still with us. If you want to add comment, Dr. Hind. I hope you didn't sleep yet. Okay, let's read the comment. Dr. Ryan said inclusion body myositis, very good differential, but very rare representation. I'm worried now they will bring this case, Dr. Ryan. You have any idea or you have any experience with inclusion body myositis in the exam? Why you mention it?
No, Dr. Basim, I did not hear when you said the proximal and distal muscle weakness, and I did not hear the examination part that it's both upper and
Okay.
lower. So I was thinking of this differential.
Okay, it's good differential, but it's very rare, and it's not logic to put it in the differential.
I wish
So-
they don't bring it, yeah.
Yeah, there is a lot of differential, or there are a lot of differential rather than this disease. So if you will put dermatomyositis here, unless you have something like muscle pain or proximal myopathy in the legs, I think this is the features of inclusion body myositis. If you read about it recently, please raise it. You can comment on this topic, or you just put it.
No,
You have
it can cause dysphagia. That's why I did not read about any in any center.
okay,
No.
and no,
But it
I
can
mean
cause
even the
dysphagia.
topic. Yeah, you can explain it more for the teaching purpose. I mean.
Okay. But what I know, it can cause dysphagia, and as you said, it can cause both distal and proximal muscle weakness, usually in old age patients. Um, uh,
Any
I
other association like
not
I think
not really, but as you said, myopathy. So the muscle
yeah,
weakness.
and muscle tenderness, I think.
I'm not sure صراحة about the tenderness, but
Okay,
I have to double check.
it's okay. We can read about it. Really, when you raise it, I'm worried now. They might bring. I don't know if they bring it before or no, but I think it's not common in the cases.
But also when you said about the reflexes that they are mute, in inclusion body myositis with the progression of the weakness, they can get like mute reflexes or hyporeflexia. That's why I was thinking.
Okay.
Anyways, if we read about it, we can share in the group, inshallah.
Yeah, let's share it.
Inshallah.
Okay, thank you, Dr. Ayan.
Thank you.
Pseudobulbar or barbar. Who wrote this? I don't know what you mean. Do you mean the stroke itself? The stroke will be bulbar, not pseudobulbar. So if he has pseudobulbar, he has another features of the stroke, like lateralization, but this patient doesn't have lateralization. So I mean in the bulbar, something in the brain stem, uh, particularly cranial nerve 9 and 10, responsible for the swallowing and gagging, and that's that mechanism, okay? So it will not be pseudobulbar. Pseudobulbar means some friction to the centers in the brain, and definitely the patient will have lateralization. But in this scenario, no lateralization. He has generalized weakness, both sides. Yeah, CPAP is one of the modes of management, non-invasive ventilation. Dr. Samah wrote new medicine, Riluzole. Dr. Ahmed wrote for you, Eltroraxine. This is new, very new, Eltroraxine. But I remember Riluzole. I don't know if this one approved by FDA. Type of motor neuron disease, bulbar or pseudobulbar? No, it's bulbar, progressive bulbar palsy. No pseudobulbar in the motor neuron disease. Pseudobulbar means something in the brain, in the cortex and subcortex, and it will affect the swallowing and the area of the oropharynx and pharynx. This is the meaning of pseudobulbar. So control from upper center in the brain, I mean, and it will impair the swallowing. But the bulbar means cranial nerves responsible for for the swallowing in the brain stem itself. It will be diseased. This is the difference between pseudobulbar and bulbar. Okay, motor neuron disease can make both bulbar and pseudo. No, I don't think it will be pseudobulbar. It's only bulbar as I mean brain stem.
نفس مبدأ الميكست. الموتور نيورون ديزيز ميكست، والسودو بلبر هو upper motor neuron lesion affection، والبلبر هو lower motor neuron. فبما انه الMND ممكن يعمل upper و lower او mixed، فبالتالي ممكن تلاقي فيه انواع. اعتقد كان اسمه progressive bulbar weakness،
Progressive bulbar palsy.
progressive bulbar palsy، عليك نور. هذا كان في منه الupper motor، تمام، وبيعمل لك pseudo bulbar symptoms، يعني upper motor neuron presentation للبلبر cranial nerve. فالاثنين ممكن يكونوا موجودين بالموتور نيورون ديزيز. انت يعني
What I remember, Dr. Hind, pseudobulbar as a term means stroke in the cortex, and it will affect the bulbar area. Swallowing.
طيب معناتها upper motor neuron lesion، لأنه الستروك بالكورتكس أعلى من مستوى النيوكلياي بالبرين ستيم. فأنت كأنك عم بتقول تعريف الupper motor neuron lesion.
Okay, you mean as a pathology, as a definition, you mean?
هي نفسها upper motor neuron lesion، مثل لما بقول لك الفيشل نيرف due to stroke، فأفكت اللور سايد ما أفكت half of the. فنفس التعريف. طب هذا بين قوسين شو اسمه؟ اسمه upper motor neuron lesion. لما الستروك يضرب الفيشل نيرف يعمل لك upper motor neuron lesion انه cortical lesion. فانت عم بتقول التعريف تبع الupper motor neuron اللي هو التعريف الحقيقي للسودو بلبر اللي هو upper motor neuron lesion، نفس فكرة الفيشيال.
No, the point is the pseudobulbar means the higher cortex, not in the brain stem. Okay, we can say upper motor in the brain stem mean the pons and medulla itself, and the lower motor will be the nuclei, right? This is the difference.
انت لا، هو مجرد ما انت تضربهم above the level of the nuclei فانت عندك سودو بلبر. يعني كلامك صح، لو انا ضربت الميد برين هذا
Yes.
above the level of the nuclei تبع البلبر، لانه البلبر موجودين
Okay.
بالميدولا اوبلونجاتا. فانا سواء ضربت الميد برين او ضربت البونز
Okay.
او ضربت الكورتكس هذا كله حيعطيني سودو بلبر، لانه هذا كله upper motor neuron.
Okay. I got it. Okay.
مو ضروري يكون ستروكس،
A
مو ضروري
stroke
يكون
and the
cortical.
cortex. Yes, yes.
لا، اهم شيء above the level of
The nuclei.
nuclei. فاذا انا مثل ما انت قلت ضربت الابر برين ستيم او ضربت الكورتكس حاعطيني سودو بلبر، حيعطيني
Okay.
upper motor neuron lesion.
Okay. Thank you, Dr. Hind, for the correction and clarifying. The other comments before ending. New medication under trial. So no need to mention if still under trial. Riluzole is the one approved. Anyway, the Riluzole has no effects. This is in real life, but you have to mention it. Yes, can cause both. Okay, thank you. Bulbar for L lower. Yes. And pseudobulbar for the upper motor. Okay. So it's something related to the nuclei, as Dr. Hind also clarified. Dr. Ahmed Ali, no role, no cause, no test. Yes, all knows here. And even no diagnosis. Or sorry, no tool for diagnosis. You wrote it, no test, no treatment, no vision affection, no bladder affection, exactly, no sensation affection. Perfect, nice mnemonic. Also no cerebellum, yes. So anterior horn cell affection either in the level of spinal cord or the brainstem nuclei. Well done, Dr. Mahmoud. Nice session.
Thank you, Dr. Bassem, but I have a question, Dr. Bassem.
Yeah,
Sorry.
sure.
About multiple system atrophy. It's come a lot in Egypt and in Oman.
Multiple system
atrophy. Yes.
هذا نوع من انواع الباركنسون بلس.
Yes, Parkinson plus Dr. Hind.
اللهم انك انت تحط 3 بوينتس ببالك. طبعا المالتيبل سيستم اتروفي عباره عن اكثر من فاريانت. في السكاي دراجر، في اللي بيجي اوليفو بونتاين، في انواع كتير. نحن دائما بننسى انه هو انواع، والانواع هي قد تكون combination of any of the following. أي combination من هدول الثلاثة موجود بالمالتي سيستم اتروفي. إما autonomic
autonomic
plus
affection. Yes.
Parkinson plus cerebellar، أو ممكن cerebellar plus autonomic من دون Parkinson plus autonomic من دون cerebellar، على بين ما يديفلوب بالcerebellar later on. فأنت بالنهاية عندك أهم شيء هدول الثلاثة component. فإذا بتتذكروا بسكيم الباركنسون كنا
Yes.
نقول we should offer cerebellar examination, we should offer what else to detect الautonomic؟
blood pressure sitting standing.
عليك نور. blood pressure sitting standing كانت هي مشان المالتي سيستم اتروفي.
Yes, exactly.
فالباركنسون بلس لو عندي أنا أي disturbance بالأوتونوميك، يا أما heart rate أو blood pressure variation sitting standing أو بالرست والإكسرسايز، يعطيك فكرة على الأوتونوميك disturbance. أو إذا عندك
Impotence as well.
symptom positive. بالإضافة لأنه المالتي سيستم اتروفي بيعطيك فايندينج بالايميجينج، مو مثل الباركنسون. باركنسون بتعمل برين ايميجينج ما بتلاقي فيه شيء، اما بالمالتي سيستم اتروفي بتلاقي يا برين ستيم تمام بيعكس لك النيوكلياي تبع الاوتونوميك نيرفس سيستم او السنتر، او بتلاقي في اتروفي بالسيربيلم بيعكس لك الاتروفي تبع
cerebellar symptom.
السيربيلم. وكان في لهم ساينز، في وحده كان اسمها هوت بان اللي هي الفطيرة كنت أضحك عليها، معناها الفطيرة الساخنة ترى، نسيانة، بس كان يطلع شكل السيربيلم بالام ار اي، إلها أسماء الساينس تبعها. فاللي بيهمني وصل لكم يا إنه أنا عندي البرين ايميجينج كتير مهم بالمالتي سيستم اتروفي.
Yeah, and PET scan will diagnose Parkinson. It's not,
عليك نور.
yeah,
فبيعطيك positive
for
findings.
idiopathic. Yeah. Okay, for the autonomic, Dr. Hind, also in the history you can ask about impotence might be affected in the
هذا لو
multi
إجاك
system.
بالهيستوري، أما بالعادة هلا أنت عم تحكي
Yeah.
دكتور محمود إجتون هيستوري ولا إجتون كلينيكال ستيشن؟
clinical station
Shorts?
كلينيكال
short
لانه ما اعتقد قليل ما
multiple
تيجي LCC بحبوها كلينيكال، لانه اللهم
yes
بحط لك بوزيتيف اوتونوميك او
it's
بوزيتيف سيربيلر، بتتحول من كيس باركنسون لكيس مالتي
multiple
سيستم.
system atrophy.
تمام. فعندك هي بحبوها كتير بالكلينيكال، لكن ممكن طبعا تجي بالLCC، ومثل ما انت قلت بقى كل الاوتونوميك سيمبتومز، impotence، gastropathy، burning، heart burn، لانه الريلاكسيشن تبع اللور اسوفيجيال من الاوتونوميك سيمبتوم. شو بدك اوتونوميك سيمبتومز بقى بنعرفها، ممكن واحد يسأله،
Impotence, yes.
لانه عندك LCC انت يعني you can ask history.
It
But
came before
don't
to
forget.
Bassem in Egypt and Oman. And
Okay, but
short one.
don't forget the approach itself for Parkinson. You have to do the all test for the examination steps of Parkinson itself before thinking about the Parkinson
طبعا
plus.
انت اول شيء بدك تثبت انك كيس باركنسون،
Exactly.
الريستنج
Yes.
تريمور، الريجيديتي،
Expression. Yeah.
البراديكاينيزيا، بدك
Yeah.
تسأله على الرايتنج، بدك تسأله على الريدنج، بدك تشوف الانسبكشن، الجنرال انسبكشن. ولا تنسى انه الباركنسون كان بي نورمال بيشنت. ليش؟ وتلاقي مثلا يعني تلاقي elderly اللهم بس expressionless face، ويعني ما تقدر تطلع السيمتومز الا لو عملت احيانا سينكاينيزيا، لانه البيشنتس بيكونوا ويل كنترولد على الميديكيشن.
Medication. Yes.
وهذا المبدا صاروا يستخدموه كتير جديد. يقول لك البيشنت هاز ريكارنت فول، اذا انت شفت من برا ريكارنت فول فتت شفته نورمال، عندك شغلتين، يا المايسينيا جريفز يا الباركنسون. لو يونج مايسينيا جريفز، لو elderly باركنسون، حتى لو لقيت كل شيء نورمال بتفوت
Mhm.
بتحس انه الكيس ما عم تعطيك فايندينج. تمام. فبتفكر بهدول الاثنين، لانه الاثنين كان بي ويل كنترولد على الميديكيشن. وممكن بقى يجيك باركنسون بلس، لو اجاك upward gaze palsy حتروح على PSP، لو اجاك cerebellar واوتونوميك حتروح على MSA، لو اجاك اجرافيسيزيا حتروح على CP اللي هو
Cortical.
السيربيلر بازلر كورتيكو بازلر
Corticobalism.
ديجنريشن.
Yes. Mhm.
فيعني على حسب الاديشنال فايندينج، لكن هل ضروري انا الاقي كل شيء بوزيتيف ولاقي تيبيكال تريمور ولاقي تيبيكال ريجيديتي؟ لا ممكن تلاقيها كتير مينيمال او سب كلينيكال فايندينجز، لانه البيشنت از كنترولد.
Yes.
يعني بيشنت اخذ الميديكيشن وجاي لعندك.
Yeah. But I think in the exam purpose they should bring manifested disease patient.
لا
not
بالعكس باليو كي هلا ممكن نحكي عنه، لكن يو كي كيسز انتبهوا منه بالذات يمتحن باليو كي. انا بعرف في سنترز تانية مثل انديا لانه بيحبوا يجيبوا الكيسز الصعبة،
مم.
لكن بيو كي مو الهدف انه تكون صعبة لما بيجيبوا لك اياها كنترول. اصلا بيو كي الانكايلوزنج سبونديلايتس ما عنده كايفوسز لانه ويل تريتد.
controlled. Yes.
اصلا الروماتويد ارثرايتس ما عنده
Yes.
ديفورميتي، عاملين له
Because
تندن
controlled. Yeah.
ترانسفير وعاملين هنيك لانه بلد علاج، مو جايبينها هدف الصعوبه مثل انديا. انديا لانه بده يعقد لك حياتك. يعني ما بدنا نقول كذابين، عيب. المهم هن they are not well controlling their cases. لكن باليو كي هن هنيك اصلا people ما بيخلوا البيشنت يوصل للديفورميتي، فلما بيجيبوا
مم.
اياها لانه ما شاء الله هن عندهم advanced caring للبيشنت.
Yes.
يعني
مم.
بيجيبوا لك كرونيك ستروك بس ما بتلاقي الكونتراكشر، ما
Yeah.
بتلاقي البيشنت
Controlled
عنده
with physiotherapy.
فليكشن
No
لانه كله
negligence.
عنده
Yeah.
advanced physiotherapy advanced treatment tendon transfer. فهديك الحالات هنيك حطها ببالك. لكن بانديا بالسنترز الثانيه اللي بتحب تجيب كيس الصعبه ممكن يجيبوها، لكن بيوكي هي الكيسز تبعهم هي
Yeah.
هيك طبيعتها
Because
هيك. يجيبوا لك
exactly.
حدا مريض ووصلان للادفانس ستيج.
Okay. Yes. You remind me when I saw patient in clinical training, myasthenia gravis patient with ophthalmos. I think his eyes already bumping out. Then I ask why he is still not yet managed. Imagine what the reply from the doctor. Because
عم
he
ياخد مصاري، عم ياخد
yes,
مصاري
he
من
earned
الناس
money
على
from
كل
this.
إنسان.
Imagine he left himself untreated to get money. This is the difference between UK and Egypt and some countries. No need to mention them. Anyway, you're right, Doctor. And
الحمد لله على كل حال.
yes,
لكن
alhamdulillah.
يعني والله إلهي يتمم علينا العقل والدين،
آمين.
لا يجعلنا شو بيقولوا نحط حالنا بمواقف محرجة سواء كنا يعني عم نعطيهم مصاري أو لا، بس يعني المفروض حتى الدكتور تبعه والله ما يرضى.
Suppose. Yes.
الحمد لله.
Alhamdulillah. Okay. Thank you, Doctor, and very nice comment and very nice session by your attendance today from the
الله
start till
يسعدك
the
يا
end.
رب. بالعكس الكيسز كانت كتير حلوة،
Yeah, thank
يعني
you.
MND و MSA يعني كانت كتير حالات حلوة. الله يعطيكم العافية.
Thank you, Doctor. Thank you so much. Thank you, Dr. Ryan. Dr. Samah, cerebellar, Parkinson, autonomic, MSA, multi-system atrophy, yes. Deformity control, Dr. Samah wrote, yes. Okay. The manifestation will be more clear here, Dr. Samah, not there. There, everything will be controlled because they have a good approach for multidisciplinary team approach. So they can manage and they have good follow-up. Of course, because of the insurance, they activated the insurance from even the first step in their country. Once you arrive there, you have to activate. It's not you have it's mandatory thing, and you are paying for it. So they are providing all these health services by taking the insurance. But anyway, this is what the people need. The patient right in the life, or the person, and let's assume the normal person, what he need, the health and learning and the food or how to survive. I mean, this is the thing need to be necessary and to be provided by the country. Okay. Again, thank you, Dr. Hind, Dr. Mahmoud, for nice case.
Thank you,
For
Dr. Bass.
okay, for other attendance and for the comments. Best for us as candidate to catch diagnose. Yeah, you can catch diagnosis in your center. Don't worry, you will have a manifested condition, Dr. Samah. And I mean, in the overseas centers, they will bring a case with good clinical signs. Unless the patient or the diagnosis is difficult to be presented as acute, I mean, acute chest pain, acute abdominal pain, so they will bring surrogate. But for the clinical, the shorts, they will bring manifested condition or manifested patient. Yes, Allah Kareem. Okay, so let's. If any other comment, Dr. Mahanna, you didn't comment today. Are you okay?
Still driving till now.
Okay.
No, I am okay. Just arrived.
Okay, welcome back and drive safely.
What is the case? Is the first case? I attend the second one. So second one, motor neurons. The first one?
Tuberous sclerosis.
Good. Okay. Perfect.
Yes, it was nice session really with the interaction and good comment also.
Okay, well
So
done.
we'll meet together inshallah tomorrow. Yeah,
Inshallah.
thanks Dr. Hadi. Inshallah, Dr. Ahmed. See you tomorrow inshallah, all of you. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.